Good afternoon, everybody. Good afternoon to all our viewers. And today in our Doctor Speak series, we have with us Dr. Ashwini Mulye. Just before I introduce our distinguished guest for today, a brief about what is that we are trying to do at Naturefit. Naturefit एक आयुष प्लेटफॉर्म है जहां आप सभी आयुष डॉक्टर्स विच इज योर आयुर्वेदा, आपके होम्योपैथी डॉक्टर, योगा प्रैक्टिशनर्स, इनके साथ आप जुड़ सकते हैं, उनसे कंसल्टेशन ले सकते हैं और सभी आयुष रिलेटेड प्रोडक्ट्स भी आप यहाँ से खरीद सकते हैं. हमारे कुछ हेल्थ टूल्स हैं जैसे प्रकृति परीक्षण, BMI, फैट. आप अपनी हेल्थ एनालिसिस भी यहाँ पर कर सकते हैं. तो इसी कॉन्सेप्ट को सबके पास ले जाने के लिए हम हमारे जो डॉक्टर्स हमारे साथ जुड़े हैं उनसे हर हफ्ते एक कोई रेलेवेंट हेल्थ कंसर्न टॉपिक के बारे में बात करते हैं. कैसे आयुर्वेदा वो पर्टिकुलर हेल्थ कंसर्न को बहुत अच्छे से ट्रीट कर सकता है. कुछ सक्सेस स्टोरीज हम अपने डॉक्टर्स से सुनते हैं. तो आज उसी में हम जुड़े हैं डॉक्टर अश्विनी मूले से. Dr. Ashwini Mulye is an Ayurvedic doctor with diploma in acupuncture and has more than 23 years of experience. She is currently working at the Dhanwantari Ayurvedic and Panchkarma Centre and is based out of Belapur, NaviMumbai. Over the past decade, she has worked on various kinds of complicated cases and healed them through Ayurveda. Currently, she is also a member of National Integrated Medical Association. She was felicitated by Sandhu Puraskar in November 2019. She has also written several articles in Ayurveda magazines. She is a social worker taking lectures for adolescent girls to follow menstrual hygiene in municipal schools and अनाथ आश्रम. आज का हमारा जो टॉपिक है काफी रेलेवेंट है, considering that menopause is something which every woman goes through, and कैसे Ayurveda, how Ayurveda works for menopause is what we would like to understand from you. So शुरू करते हैं मैम कि what is menopause, what are the common symptoms of menopause, usually किस एज में ये women को टच करता है. So, yeah.
Menopause is like cessation of menses. When a female doesn't get periods for over 1 year, we call it a menopause. Now we can divide the symptoms into 3 parts, like perimenopausal age, menopausal age, and postmenopausal. जैसे कि perimenopausal age, it begins around 40 to 45 until 50 is considered to be the entire menopause ka phase. What happens nowadays, because of the change in lifestyle, we get to see the perimenopausal symptoms even as early as 35 years of age. The common symptoms are regarding the menses. There is a lot of heavy bleeding, passage of clots. We call it as dysfunctional uterine bleeding. Or sometimes you get periods twice a month, thrice a month, or they don't stop until you take some medication. Another symptom is that there are no proper periods due to anovulation, and there is only spotting for months, 2 months, 3 months. There is vaginismus in the vagina, itching, vaginitis, and even there is a lot of mental problems also, like you feel like depressed, stress, anxiety, irritability is there, mood swings are there, like sleep apnea, your sleeping pattern also changes. And several other symptoms. Sometimes some people might get some digestive problems also. But it is not necessary each and every symptom will happen to every lady. It differs from person to person, depends on their prakriti, their lifestyle, their eating habits also.
Right. True. So मैम जैसे आपने बताया कि हर तरह के सिम्टम इसमें हो सकते हैं, फिजिकल, मेंटल, इमोशनल, बहुत ज्यादा हार्मोनल चेंजेस होता है, एंड दैट इफेक्ट्स तो बोलते हैं कि बच के रहने वाला स्टेज रहता है फ्रॉम अ वुमेन. तो वही हम जानना चाहेंगे कि कैसे आयुर्वेदा, बिकॉज ये स्टेज तो हर इंसान को, हर वुमेन को शी हैज टू गो थ्रू. तो हमारे वी कैन नॉट अवॉइड इट, राइट? नो वुमेन कैन अवॉइड द थिंग्स दैट आर गोइंग टू हैपन. हाउ कैन वी बेस्ट मैनेज इट, एंड हाउ आयुर्वेदा अप्रोचेस मेनोपॉज डिफरेंटली कंपेयर्ड टू द modern medicine?
Yeah, rightly said, ma'am. It's a physiological change. Every woman has to go through it. See, according to Ayurveda, जैसे आपने कहा है प्रकृति परीक्षण, वात पित्त कफ तीनों दोष every person में रहते हैं. But according to age, in the childhood there is kapha dominance, in the middle age there is pitta dominance, and in the old age there is vata dominance. So this particular age from 40 to 50, जहाँ पे पित्त प्रकोप भी रहता है और थोड़ा उसका डिक्लाइन होता है और वात वृद्धि काल बढ़ जाता है. So if we think of vata vritti, we can treat the patient accordingly. So we can give snehan, swedan, basti, जो वात वृद्धि वातनाशक चिकित्सा है वो हम दे सकते हैं. Another thing is menses और आर्तव is the उपधातु और सब धातु और रस धातु. तो जैसे ही उसका कर्म खत्म हो जाता है, रजो नाश हो जाए, रजो निवृत्ति हो जाते, तो काफी सारी मनोवह मीन्स माइंड से रिलेटेड प्रॉब्लम्स हो जाते हैं, बिकॉज रस धातु इज वेरी मच क्लोज टू मनोवह स्रोतस. That is why we get all this hot flushes, irritability, sudden annoyance या anxiety, stress. काफी हद तक पेशेंट्स को डिप्रेशन भी हो जाता है. तो उस हिसाब से विचार करेंगे तो हमको रस धातु, कफ दोष और पित्त का प्राबल्य, जैसे हर पर्सन के पर्सन में डिफरेंट रहता है, उसका विचार करके हम चिकित्सा दे सकते हैं.
Right. And are there any particular Ayurvedic herbs or remedies which are commonly recommended for managing menopause?
Yes, like the most important vanaspati I could suggest is Jatamansi, which is a mind stabilizer, जो mood swings or sleep apnea है. So I use a lot of Jatamansi. Tagar है. Then Vasa. Vasa usually adults we think only for cough, but it is a very good thing in reducing menstrual bleeding. अगर heavy bleeding, dysfunctional uterine bleeding, clot वाला bleeding है, तो I use Vasa and Guruchi also. Then Gokshur है, Pata है, Shatavari, so known, everybody knows Shatavari. Sariva है, Durva है. Durva reduces the body heat, hot flushes a lot. And even Gokshur, Pata, Kutare. These are the basic herbs we extensively use in all the kinds of complaints.
Great. So there is, actually बोलते हैं ना कि there is so many miraculous herbs and हमारी nature में ही ये सब है. Just we have to use the right ingredient or the right herb for the right ailment. And what about the lifestyle changes or dietary recommendations? कैसे उनसे हम help कर सकते हैं, support कर सकते हैं for menopause?
Yeah, I would like to highlight a few things over here because nowadays our lifestyle has changed a lot. So if we follow Ayurvedic lifestyle, इसमें है कि रात्रि जागरण नहीं होना चाहिए, जो आजकल बहुत हो जाता है, watching movies on Netflix and all, working on laptops for a longer hours, getting up early, then exercise दिन में होना ही चाहिए, at least for 1 hour or according to what your body constitution is. Especially I would emphasize on yoga, meditation, and I would also emphasize on your routine habits. जो आयुर्वेदिक दिनचर्या अगर आप फॉलो करते हो तो खाना तभी खाना है जब भी भूख लगे, पानी तभी पीना है जब भी प्यास लगे. Unnecessary extra drinking of water menopausal age में काफी लेडीज करती है, thinking that they should maintain their hydration and all. So the intake जो है proper होना चाहिए. जो regular food है, whatever you're eating should be nicely cooked, fresh, और basic ही का at least 2 to 3 tablespoon it should be there in your daily diet. Also, I would emphasize the fact on annual panchakarma, जैसे स्नेहन स्वेदन बस्ती है. अब ट्रीटमेंट में तो पंचकर्मा का इन्वॉल्वमेंट है ही, but if you start taking proper panchakarma, ऋतुकालीन शोधन, right from the age of 30-35, this phase will be so that you will not understand also you have achieved your menopause. जैसे आप वमन है वसंत ऋतु में, कफ प्रकृति का पर्सन है, तो if he takes वामन इन वसंत ऋतु, स्नेहन स्वेदन बस्ती इन वर्षा ऋतु, एंड पित्त डोमिनेंट अगर लेडी है, she regularly takes विरेचन, रूटीन अगर इसको डिटॉक्स करती है उसकी बॉडी को, शिरोधारा लेती है, नस्य लेती है. नस्य इज ऑल्सो वेरी इंपॉर्टेंट पंचकर्मा which works in menopause. So she will not get the problems or the symptoms. She will undergo the phase, but she will not face it very like too much. She has to rush to the extreme conditions.
Right.
And another thing I would like to highlight is the investigations. Like we must not ignore certain investigations like pap smear, then cancer markers, जो है CA125, or for the endometrium also, sonography, mammography. It should be routinely done because we can catch even the earliest stage before the development of cancer, and we can treat it accordingly. So this is another point I would like to highlight. And the third point I would like to highlight is that a woman, we are all multitasking women. So she should give time for herself. She should cultivate her habit, her hobbies like learning music, dance, or reading. She should make friends, go out, and even her family members, I would suggest, should help her in her menopausal period, so that knowing that doing small things in the house, working, and so that she will feel that she is being taken care of, because this is the beginning where hypertension or diabetes or depression, these all things start coming in if the woman is not protected or she is not given that care in that period. So you should have a positive and holistic approach towards menopause.
Absolutely perfect. Perfectly summarized that sabhi cheezein, because it is not just a body that is going through this. There are a lot of implications on the mind and too many changes that is happening from, it's like पूरा एक stage हमारा change होता है. तो इसमें सबका support and सबकी understanding that what the woman is going through. And I think the most important thing जो आपने highlight किया कि women को समझना चाहिए कि मैं इस stage इस time पे ज़्यादा से ज़्यादा अपना ध्यान रखूं, because we at the end of the day it's us, जो हमें अच्छा लगे वो उस पे ज़्यादा time लगाना. So I think that's a very good approach to something which we treat as maybe a disease or a condition, but there is a very holistic and a very easy approach जो हम इस पे ले सकते हैं. So moving forward, ma'am, we would like to know one or two of your patients जो इस menopause के through गुजर रहे थे और कैसे आपके पास आके आयुर्वेदा के थ्रू एंड ये होलिस्टिक ट्रीटमेंट के थ्रू कैसे वो इजीली इसको कर पाए.
Yeah, like getting 23 years of experience, I've got many cases to mention, but two remarkable cases I would like to share with you. A female of age 45, 46 years, she came with profuse dysfunctional uterine bleeding. She had done the DNC earlier, 2-3 months ago, but yet the bleeding was there again. So, and her hemoglobin was also very low. So first at that stage, she was so weak. So I first gave her my Ayurvedic medicines and certain bastis. Bastis are Ayurvedic oil in enemas to control her bleeding. In 10-12 days, the bleeding was controlled. 1 or 2 months, we gave her medicine so that her hemoglobin will rise. She'll gain strength. And then in Vasant Rutu, we did proper Vaman, that is Shodham. And with that, she almost her episodes of heavy bleeding and all were reduced. And again, I gave a repeated Vaman after 2-3 months with small dose. And with that, she attained her menopause. As most of the gynecologists in the city had suggested her to do hysterectomy. But after that, she did not need to do any hysterectomy. And after that, I also gave her some Yapana or Tiktakshir Basti because the phase she had undergone, because there is a lot of weakness, bone density gets reduced, degenerative changes because lack of estrogen. So we can help that also with Ayurveda by giving Tiktakshir Basti, Yapana Basti. So now also, it has been 10 years, she is coming, she is fit and fine. So many cases like that, but this was a case which I also was feeling, okay, let us see. But she had more hope than me also.
Great. Ma'am, the most beautiful thing I think about Ayurveda is कि आप चाहे 3, 4, 5, 6 महीने का ट्रीटमेंट आपके साथ करते हैं, but जो आप एक लाइफस्टाइल चेंजेस उनको दे देते हैं, वो उनके साथ हमेशा रहते हैं. And they might not even require to do so much of intervention. Look at a modern medicine, there is a continuous intervention required for medication and all of that. So I think Ayurveda एक पूरे तरह आपको एक होलिस्टिक अप्रोच देके एक लाइफस्टाइल में ही आपके वो घुस जाता है, और अगर हम उसको अडॉप्ट करते हैं then we will never require medications and all of that. So I think that's really remarkable. Ma'am, any other story you would like to share?
Yeah, I would like to share one more story, like how I'd said in menopause, there is a lot of vaginal dryness and itching. So I had a patient few years ago. She already had menopause, but she had so much of dryness in the vagina and itching that everything, infection and inflammation was there. So we use certain vaginal douches to clean it with Ayurvedic kada or decoction. I gave her 7 to 14 sittings, and after that we give a vaginal swab with Ayurvedic oil, which will maintain the lubrication of the vagina. So
Okay.
after that treatment and some oral medicines, it was she got cured with that, and she was happy. So this is another symptom which totally got cured with Ayurvedic treatment. So I would still emphasize more on all the panchakarmas, nasya, and annual panchakarma shirodhara and all, so that women will go easy. मतलब सुख never menopause होना चाहिए. And she should live for herself.
मैम पंचकर्मा तो एक जैसे हम अपनी गाड़ी की सर्विसिंग कराते हैं, बॉडी इज ऑल्सो अ मशीन. तो आई थिंक पंचकर्मा इज लाइक एनुअल जो हमारा मेंटेनेंस होना चाहिए. तो इवन इफ हम ठीक है या हम बीमार हैं, आई थिंक पंचकर्मा इज समथिंग विच एंड यू कैन क्यूरेट द ट्रीटमेंट फॉर अकॉर्डिंग टू द हेल्थ कंडीशन. बट हमें एक माइंड में बनाना ही चाहिए कि वो करना ही चाहिए. वी हैव टू टेक आउट सम टाइम फॉर दैट. And I think that's very important. Yeah. So thank you so much, ma'am. It was great to know that how, Ayurveda and simple lifestyle diet, holistic approach to menopause. Also जो हम आयुर्वेदा के बारे में जानते हैं कि वो प्रिवेंटिव ज्यादा है. अगर हम उसको अभी अडॉप्ट करें, तो हमें वो कंडीशंस बहुत इजीली हम पास ऑन कर जाएंगे, एंड वी विल नॉट हैव एनी मेजर disease or outcome through that. So thank you so much to guide us about that today. And you can all consult Dr. Ashwini. The profile link is there given in the description. आप वहाँ पर क्लिक करके उनके साथ अपॉइंटमेंट बुक कर सकते हैं. आप उनके क्लिनिक में जा सकते हैं. बेलापुर नवी मुंबई में है. And ma'am also takes online consultations. So thank you so much, ma'am, for this wonderful session, and thank you the viewers for viewing this. And we will again join next week with a few more sessions on the same. Thank you so much, ma'am. Thank you for your time. Yeah,
Thank you, ma'am, and Naturefit.
Thank you, ma'am.
Right.